Now, another area that we've got a strategic partner identified is in the hospitality space. So we've recently launched an agreement with HHS. And when we talk about hospitality, we're talking three different dimensions of service, whether it's environmental services, food and nutrition, or patient transport. And what we do have with HHS is really looking at their experience in the industry. Where have they had success? How are they leveraging their experience, their technical expertise around training critical staff in this space to achieve the results they're seeking? We saw a lot of value in that. So we've consolidated that activity within Bon Secours Mercy Health to a single provider across all three dimensions. There's inherent value with just that step alone, but the future is where we really see the innovation and value coming, because we know that workforces are very challenging today. Recruiting and retaining skilled labor in these spaces is something we're all challenged with. And the model we're designing with HHS is looking at breaking down the pillars and silos, frankly, of those individual services, and frankly, looking at it more as a holistic service where we can upskill our teams to be able to perform tasks across that entire spectrum. And by doing that, we get more value out of our labor force, and we create more value for the member. And I think we're excited about that relationship and where it's going to go. And I think we know that relationship is something that's going to be revolutionary in the industry.
Yeah, and to draw on that a little bit, John, we know, and I'm glad you touched on it, different than HTM, where it's a technical skill, and the workforce that plays in that space is probably different than what we experience in hospitality. Could you talk a little bit about how we actually view in the future that function and how we plan to optimize and maybe even make the patient experience a little sweeter as we look into the future?
Yeah, absolutely. So as we mature that program, we look at all of the individual responsibilities and tasks that are necessary across those three different service areas. And how do we upskill a workforce to be able to perform tasks across all three different dimensions so that, frankly, we can minimize the traffic in and out of a patient room, for example. If we can limit that and make that a positive patient experience, that's another win that sometimes doesn't necessarily translate to the bottom line in terms of dollar reduction, but from a patient satisfaction perspective, we know that can really drive up our performance there.